All right. Hello, everybody. Good morning. It's Dr. Arafich from Vet Triage. It's July 12th, about 9:30 in the morning, Pacific time. And we're going to talk about dogs with soft tissue sarcoma. Um, this one could be a bit tough because anyone who's dealt with this with their pet will know this. But soft tissue sarcomas are um, somewhat common, but they can look so different from dog to dog. And there's different histologic types with this cancer in dogs, so it makes it a bit confusing even for veterinarians. But that being said, we'll talk about it here in brief. The other thing I'll mention also with this is that um, how veterinarians approach this also will vary, and which makes it even more difficult to get kind of like a consensus as far as how to handle these. But I'll tell you from my point of view as a surgeon what my recommendations usually are with these tumor types of how I handle them. So, a soft tissue sarcoma is a cancer that it can affect pretty much any body, any tissues in the body. They are known for being locally very invasive. They form these like tentacles. They go under the skin and go in between tissue planes, which make them very invasive and also very difficult to remove completely with surgery. So they can be quite difficult. In fact, those tentacles are the biggest reasons why the recommendations are what they are, which we'll go over. And it's the biggest reason why these tumors come back after surgery. So, as far as what you as a pet owner will notice with soft tissue sarcomas, they can look quite variable. Usually, though, they're on the skin, any part of the body on the skin surface, you'll see them. They can be fairly small, fairly large. They can be lumpy and bumpy, or even ulcerated. And so, there's different looks, different appearances that they'll show up for clinic with. Um, there are different types of soft tissue sarcomas. These are based on histology, so a microscopic evaluation of the cells from that tumor. Common ones include fibrosarcoma, peripheral nerve sheath tumor. There are many others, and that's part of the confusion with this is that soft tissue sarcoma as a category is a broad category that includes many different types of malignant cancers. But usually it affects the skin and subcutaneous tissue, and like I said, they're fairly locally invasive. Um, as you diagnose a higher grade of tumor, which means more aggressive, then they tend to be more locally invasive, which is common sense, right? A high grade tumor will act more aggressively than a low grade tumor. The chances of a soft tissue sarcoma spreading to other parts of the body, like outside the skin and subcutaneous tissue, is about 20% incidence in dogs. So 2 out of 10 dogs will have cancer spread outside of the skin or subcutaneous tissue. And that chance for spreading to other parts of the body does correlate with the grade of tumor. So the more aggressive the cancer is, the more likely it is to spread. With grade 1 soft tissue sarcoma specifically, it's about a 15% chance, so 1/5. Same thing for grade 2. And with grade 3, which is the highest grade, about 40% of cases will have spread. So that 20% I mentioned earlier is overall chance of spread. Grade 1 and grade 2 are 15%, and grade 3 is 40%. The median time between diagnosis and spread to other parts of the body is about 1 year. So that's pretty slow even for an aggressive tumor. But these tumors tend to be pretty slow growing, so that's kind of not too surprising. But it's even with spread, so it'll take a median of about 1 year. Now, when you go to your vet, what they're going to recommend doing, besides of course sampling that tissue with either a fine needle aspiration and cytology, or with a biopsy, an incisional biopsy, and then followed up with histopathology, they're going to want to make sure there's no evidence of cancer spread, and they're going to want to make sure that they can figure out what the tissue margins are. As far as finding cancer spread, at minimum, 3-view chest X-rays are the foundation that most vets have access to, and that looks for spread of cancer to the bones in those X-rays as well as the lungs. However, probably a full body CT or even MRI would be a better way to go about it, because it'll give you more detail for cancer spread and also will help the surgeon with planning for how to operate this tumor. So I frequently will perform CT scans, CAT scans, computed tomography on these dogs to see what the surgical planes are that I have to plan for surgery. And that's probably the most challenging thing for these cases, because not every vet has CT scan. Not every client can afford CT scan. Not every vet even is aware that CT scan is the ideal way of going about this in order before performing surgery. So they'll, with good intentions, the doctors will try to remove these tumors, but they're not being aggressive enough, and then it ends up coming back. And every time it comes back and it's removed again, the time between removal and return on that tumor shortens every single time there's more surgery on it. So you want to be aggressive at the first attempt at surgical removal with these dogs. So when you do try to remove these tumors, you want at least 3 centimeter margins. So a margin is the amount of distance between where the tumor ends and there's regular tissue, normal tissue. So if you want 3 centimeter margins, that means you want 3 centimeters of normal tissue beyond the visible boundary of the tumor edge. And then you want to include one fascial plane below if possible. And the reason why if possible is because if you have a tumor that's on the side of the chest or the abdomen, well, then you're looking at literally going into the abdomen to try and remove it, because you want to remove the abdominal wall or the thoracic wall on that side. So other locations won't usually enter body cavities, but if it's on the chest or the abdomen, you may have to. Otherwise, if it's really bad and it's like on the leg, then amputating the limb is going to be the way to go. If your veterinarian removes a tumor and the margins are incomplete, meaning you didn't get those 3 centimeter margins of regular tissue, then ideally you would have another surgery to remove the actual scar in an attempt to get more cancer cells. So that's how aggressive you have to be with removing these. Radiation therapy might help if surgical margins are dirty, meaning you didn't get your surgical margins. Or maybe because of the location of where it is in the body, it's impossible to get margins, then radiation therapy can help after surgery to try and control local cancer growth. And then finally, some chemotherapy can help with local control, but it doesn't seem, these tumors in general are fairly chemo resistant. And so surgery is the first line of defense, and radiation and chemotherapy can maybe help. So as far as recurrence rate, if you have dirty margins upon removal, then the recurrence rate could be as high as 20 to 35% for these tumors. And of course, with the higher grade comes a higher chance of them recurring. Radiation therapy will allow for local control in 5 to 30% of these cases by 1 year. And about 2 years' time, it'll recur. So radiation therapy is not a bad option for those who have access to it, who can afford it, and it can give you some pretty good numbers relative to the diagnosis. Obviously, 1 or 2 years is not great, but considering how aggressive this is, it's at least you're getting a response. And then chemotherapy kind of is all over the place, but typically it's not that great for chemotherapy. Finally, in regards to prognosis, prognostic factors, we mentioned multiple times now, a higher grade means a higher chance of local recurrence. Also, a higher risk of local recurrence if the margins from surgery are dirty. If it's a large tumor, then there's a higher chance of recurrence, which makes sense because usually larger tumors are harder to remove completely with surgery. And another risk factor for local recurrence is a history of local recurrence. So if the dog already had this tumor and then it regrew, and you remove it, the chances of it regrowing and faster each time is much higher. And then as far as the prognostic factors for not local recurrence, but survival or spread to other parts of the body. The grade, which we mentioned before, the mitotic index, which is it'll come with the grade. The mitotic index is how many cells on that slide from the biopsy are showing active signs of reproductive replication. So that's the mitotic index. Oh, we have Daniel Brown visiting us here. Hi, how are you today? Good morning, New Zealand. Welcome to Yes, Good, my friend. Yeah, hey, Daniel. Thanks so much for that warm welcome. Hello to my New Zealanders out there. Yeah, thank you so much. Any questions you have, let me know. And so besides the grade and the mitotic index being a risk for death eventually within this cancer or spread to other parts of the body, the local recurrence rate also plays a role in that future spread of cancer. So yeah, that's probably good enough for this one. This is for those of you who have dealt with this personally, it can be very frustrating, and understandably so. But hopefully that shed some light. Any questions, let me know. Thanks again for Daniel Brown for visiting today. Thanks for everybody on the playback, and we'll see you in the next one. Take care.